Global Academy for Community Health System Resilience, it's a gathering of leaders, community leaders from several countries. We are bringing them together to reimagine the role of communities in designing solutions to advance community health system resilience.
Communities First Global Collaborative was designed in response primarily to the global pandemic. We saw that in the global pandemic, when all systems failed, health systems, housing systems, we were all sent home and there was so much trauma, but the leaders that really rose up to the occasion were community leaders, community-based organizations, unusual suspects who really understood the complexities of their neighborhoods and their neighbors themselves, and created informal systems to address the pandemic and the crisis. And then we realized we needed to create a system and an organization and a community that was responding to more than one crisis, that was ready to plan and create systems of resilience to support leaders of the future.
We are bringing community leaders to share their best practices, their playbook, and be able to really have a community, a reserve force as we prepare for any future pandemics. We believe that as we see emerging crises, humanitarian crisis, pandemics, it is time to invest in community leaders who can design community health system resilience strategy and being able to drive their communities through the challenging moments.
When I looked at the program, for the fellowship or the collaborative, I felt the desire to come learn more because I was made aware of the reach or the potential of collaborating with similar like-minded people, but people who have been and have done and tried systems of change in different countries.
Well, actually, Mickey brought me to the collaborative through PIH, and it was because of the community engagement and the work that I did on the ground. So she nominated me, and I guess I won. I'm here.
You did. And the whole reason we nominated Melissa is because we believe in community resilience, and that change happens at the community level, and she is just a pure example of what happens when you have not only a community member, but someone in leadership that cares about the well-being of their citizens. And now we're here to learn how other people and other health systems operate and how we can take those learnings back to the U.S.
Now more than ever, we're seeing both the interdependence of our crises, so it's not about country income or GDP that determines people's outcomes. In fact, when we look community to community, no matter what a country's revenue stream may be, the problems and challenges are much more similar than they are different.
COVID-19 has taught us a big lesson. No country in the world was prepared to handle COVID-19. And what is in the store for us in the coming few years? There are several global health issues we are not prepared for. So this academy will help practitioners create a community of practice to think through different global health problems.
We need leaders who understand the complexity of the challenges and also who understand how to weave networks to respond to those challenges in a timely manner.
I think one of the most important things is the exchange of ideas, the learning from a different perspective, being exposed to other people outside of my immediate community and doing amazing work, building resilient communities and defining that and the way that applies in their own spaces, I think has been amazing.
I'm going home happy, and I have also learned quite a lot. So that exchange of knowledge and also sharing the best practices, it's very important to improve, to learn from one another and improve delivery of the services.
I think for me, this is an expression of the power of networking, because most partnerships will come also from networking, most collaborations will come from networking.
We need leaders from Rwanda and Malawi to share their playbook. We need to see Lesotho and Rwanda sharing the same.
Is that we will see people living improved lives, people living in conditions that enable them to thrive. We will see that.